Kathleen. Nice to
Hey.
see you again. Welcome to
Yeah.
another episode of the Healthie podcast. I'm Dr. Jesse Abend, and that's Kathleen Ascanio, registered dietitian. Good podcast today.
It's a good one. This topic, I don't feel like is as hot as some of the other ones, but I definitely think it should be.
I agree.
Yeah.
Because I think it's not necessarily as sexy as most trendy diets are. I also happened to see, it was funny. We talked about the carnivore diet, and
Yeah.
have you ever heard of the Liver King?
Yes. And then he was doing all those steroids.
Yeah. So
Yeah. It was crazy. What did they say? Like $12,000 worth of steroids a month?
Yeah, not that much,
Just like a small amount.
It's a little steroids.
Just a little boost. Yeah. That's unfortunate.
Yeah. But I mean, he's a good businessman. But yeah, I think that's when it comes to diets and these sort of extreme types, that's usually what you're going to find. Someone sort of pushing some sort of business, some sort of sale. And I mean, can it do some good? Perhaps, yeah. I mean, there's some good principles in there, but at the end of the day, like anything in life, diet's never like this one extreme thing. It's complicated and it's different for everyone.
Yes, it is very complicated. I mean, and I think the word diet kind of gets taken out of context because before it really meant just like, how do you normally eat on a daily basis? That's your diet. That's what you do. But now it's like, it's a program, it's a quick fix, it's a moneymaker. And typically if somebody's going to make money off of it, it's probably not going to be in your best interest. So, whenever you find like these weird programs and they're like, well, you have to buy this supplement from this company. And if it's coming down to that bottom line, it's just really not ideal.
Yeah, that's a good point, and that diet is just the way we eat. But then diet has been it's a marketed term now. It has a bad connotation to it, even though the real definition is just how one eats.
Yeah, that's it. Just what you do on a daily basis. So how do you eat?
So going on to that point, we'll be talking about the DASH diet today. You brought this to my attention. You wanted to do this video. I agree. It's a great type of eating, and it was created for a good cause.
Yeah. So the DASH diet is probably one of the only diets or eating approach, sometimes I like to say it that way, that has actual research behind it. So, there are some like the carnivore diet, like we talked about last time, that it's getting promoted by some influencers and things like that, but it doesn't have a lot of research backing it. So one thing is the DASH diet does have that research. So it stands for dietary approaches to stop hypertension. And we'll kind of go through some of those approaches and like what it means and what are some of those little aspects as well.
And I like the hypertension part because as a doctor, that's something that I see very often.
Yeah.
And for there to be a diet made to sort of help with blood pressure, it really tells how big of an issue hypertension or high blood pressure really is. Most patients who I see in the office, outpatient and also in the hospital, they typically have high blood pressure issues and are on, not just one medication, but multiple medications. And the reason it's so important to manage blood pressure is because blood pressure essentially affects every single organ in your body. One of the scariest things that I see and have seen is a stroke, patients having strokes, because it essentially paralyzes you if it doesn't kill you, and it really disables you. And there's nothing you can really do about it once you get the stroke, typically. But the main risk factor for having a stroke is high blood pressure. Essentially, over time, essentially what high blood pressure is your heart is pumping blood throughout your body, and that blood has to reach every single part of your body, every single cell in your body to give it the nutrients and oxygen that it needs to survive. However, if that blood pressure is too high due to maybe reasons with your diet and lifestyle, that pressure essentially can damage those cells.
Mm-hmm.
It's almost logical. If there's a really high impact against something, over time it's going to wear away and damage it. And that's what can lead to a stroke, which is absolutely terrible, as well as heart disease.
Yeah. I mean, heart attacks, kidney disease, everything, like your brain, eyes, all of it. Lungs.
Everything.
Yeah. So managing your blood pressure, I think it's very, very important if you have high blood pressure, or if that even runs in your family, because that puts you at risk as well.
Exactly. And there are, like everything, there's always a genetic predisposition. Most cases of hypertension or high blood pressure is due just from lifestyle factors, and largely preventable through diet, exercise, being healthy, mindful, managing your stress correctly. There's a small percentage of high blood pressure that's due to other genetic issues and organ issues, but it's a small percent. So it's good to know that we are essentially in control of whether or not we have high blood pressure or not, and there is something we can do about it.
Absolutely.
So to begin, you want to get started on what the DASH diet is?
Yeah. So like I said, it's the dietary approach to stop hypertension. And what it really focuses on is increasing nutrients that help lower blood pressure, and also decreasing things that raise your blood pressure. And we'll go into some of those, like I said. So some of the foods that help your blood pressure, well, I should say nutrients. Let's start with the nutrients, are potassium. So potassium can help lower your blood pressure by getting rid of extra sodium in your urine. And I honestly didn't know that until I was kind of looking this up. So it helps your body get rid of all the excess sodium. And as Americans, we consume probably 3 to 4 times more sodium than we need in a day. And sodium is one of those things that directly impacts your blood pressure. And we'll talk about that in a minute. But here it is. It's one of those things, and potassium can help us get rid of it.
So why do you think that Americans, we consume so much sodium?
Convenience, eating out, sodium is found in a lot of high processed foods. We're a very busy culture. We are always on the go. So it's like, what can I get really quick that's going to fill me up and keep me going? So that's just kind of the nature of it, is that salt is a part of processing, and it's a part of preservation, I guess. So it's going to be in all of those shelf stable foods,
Yeah, and as humans, we're very attracted to salt. It's like salt, sugar. There are specific things I guess we're attracted to because it has an important role in our body. However, when there's too much salt, it can cause harm. And salt is put into a lot of these processed foods, and to help preserve them, as well as to enhance taste. It's such a great taste enhancer. So we sort of abuse it.
Yeah, absolutely. And then, I mean, even eating out, we eat out more now than we have in years past. And if you think about a restaurant, what is their goal? To make money. Well, how do we do that? We have food that tastes good. How do we do that? We add salt and we add fat. And again, 2 things that are going to directly impact your blood pressure and your heart health.
Yep, exactly. Salt makes it tasty, and we want more. However, it comes at a price.
Yeah. I mean, have you ever gone out to eat and then just next day, your hands feel kind of swollen?
Yes. And because I'm used to eating, pretty healthy, when you're used to cooking for yourself and being in charge of what you put into your foods, you learn to adapt and understand what food really tastes like without all of these additives. But when you go out to a restaurant or eat a processed foods, you can really understand and see how much salt there is in that meal. And it's not so good if you're used to eating generally healthy, and you really realize, wow, there is a lot of salt that is in these foods, and we've become so accustomed and conditioned to wanting this much salt. And for a lot of people, if we don't have that much salt, we think foods are disgusting and we don't want to eat it.
Yeah. Yeah. And I mean, kind of to play off what you just said, if you're used to eating all of the salt and what I guess some people would consider low sodium, or I guess just no salt added, wouldn't taste good. So then they're constantly adding that salt. But you can change your taste buds. So you can slowly start to scale down that salt. So, if somebody is just like, if that's the first thing to do is they grab that salt shaker, well, you can kind of train your taste to say, you know what? No, maybe I don't need all that much salt. It does take a little time. That doesn't happen overnight, but you can do it.
Yeah, exactly. It's just kind of taking time to decondition yourself, and just slowly kind of taper off the salt.
Yeah. Taper it off. I think that's a good way of putting it.
All right. What's the next nutrient you want to speak about here?
Calcium. So calcium, we all know where to find calcium. A lot of your dairy products, so your milk and yogurt. And believe it or not, sardines and some leafy greens have calcium. So it's not
I
just...
like sardines. I really enjoy them.
I don't.
Yeah. Yeah, my wife is grossed out as well. I have lots of cans. I'll eat it right out of the can. It's very simple. It's good. It's delicious.
Yeah.
It packs a lot of nutrients.
Yeah, believe it or not, my 1-year-old son loves sardines, but I can't do it.
Nice. Me and him, I like it.
Yeah. Yeah. So your calcium, it's a little unclear to me, and I don't know if maybe you would know how calcium itself can actually help lower blood pressure. But from my understanding, it kind of just helps with like the regulating process with vasoconstriction and increasing vascular volume. Can you speak on that?
Yeah, I know for some of the medications that we give for blood pressure are called calcium channel blockers. So calcium is involved. Calcium essentially, I have to go back now to my early science days, to be honest, but calcium does play a role in sort of how relaxed your blood vessels are. So yeah, calcium is involved.
Yeah. And I want to say it has something to do with the pituitary gland, maybe, and some sort of regulating system. But point being, get your calcium.
Absolutely.
Yeah. So another one is magnesium. And magnesium actually plays a role in kind of just like a relaxation for your body. And it can kind of just help your blood vessels chill out a little bit. So, and some of these foods that have all of these nutrients are foods that are typically like plant-based. So that's, I think, part of, the whole plant-based eating comes in. But they're fairly common. You're looking at like avocados, nuts, grains, a lot of high fiber foods, which we've talked about before, just have amazing benefits. So it's not just like, oh, eat your veggies because they're healthy. It's like, no, actually eat your veggies with a purpose because they're going to do great things for your body.
Yeah, but I'm a carnivore though, so I don't want to eat my vegetables.
To each their own. That's fine. Because potatoes are bad for you because they can kill you. Per our last conversation. But please eat your veggies.
Yeah, no, I'm joking. I'm gonna eat my vegetables, definitely.
Yeah. Yeah. And like I just mentioned, fiber is one of those great things that does help lower your blood pressure. It kind of, if your body is dealing with higher cholesterol, fiber kind of comes in, takes it out, sends it out and says, hey man, you're not welcome here. It's also a little unclear if it's just like high fiber foods being those vegetables, whole grains, and that also having impact on other things such as like your weight and blood sugar control, which might help blood pressure in a secondary sense. Or like I said, or if it's just a lot of those foods that have high fiber also have all those great nutrients that helps your blood pressure as well.
Yeah, and I think that's an important talking point in that you're mentioning specific nutrients, but in the end, I mean, this type of way of eating or diet is just encouraging overall healthy whole foods.
Yeah, that's it. Fruits, veggies, fiber, grains, all of them.
And with that, it's going to help moderate your blood pressure in addition to helping you prevent diabetes and heart disease and all these other diseases that we typically see when you eat unhealthy.
Exactly. And so that's what this whole kind of concept came in. Is it really helping blood pressure or is it helping other things as well and just like blood pressure being controlled is that a secondary like benefit, you know? I think it's a primary benefit. And then you just look at all the other things that, I mean, weight management, there's just so many other benefits from eating in this style.
Yeah. When it comes to disease, I mean, disease, everything, all the hypertension, high blood pressure, high cholesterol, heart disease, diabetes, these are all sort of just kind of marketing terms in a way, but they all stem from the same thing for the most part, which is just, the way you eat, the way you move. So when you change the way you eat, you're not just going to be affecting one of these diseases, because it's not really just one thing. Everything is, your body is one big functional unit. So you're going to be not only preventing high blood pressure, but like we said, just overall creating a healthier body and preventing or delaying the onset of disease.
Yeah, it's like one thing kind of just domino effects into another. And that even goes the opposite way. So, like you were talking about earlier with blood pressure affecting all of your organs, it's like one little piece can just throw off everything in your body and just wreak havoc. And then that's where we start seeing all these diseases come in. And, it's like somebody who suffers from one disease likely suffers from XYZ disease because it's all connected.
Exactly. It's not just your blood pressure, but your kidneys are also being affected by this. Your brain is also being affected by this. We may have the numbers now for your blood pressure saying you are above what you should be, and maybe we can't see the damage that's occurring in your kidneys at that moment, but it is. And then eventually you do see that, but everything's being affected.
Absolutely. So let's kind of like talk about some of those things that negatively impact your blood pressure. We mentioned sodium, and that most Americans get like 3 to 4 times the amount of sodium. I think you touched on this earlier too, that water follows salt in a way. So, when you consume a lot of salt, we mentioned you get kind of swelly and tight. If that's happening on a consistent basis in your body, and your body's trying to push blood through puffy, swollen areas, it's going to have a hard time, and it has to work harder. So in a way, increasing your blood pressure. And again, that's where you're looking at, of course you have like the actual salt shaker, but your processed foods, a lot of restaurant foods are high sodium, canned goods, those processed, but.
Yeah, definitely make sure to look on the labels how much sodium is in your food.
Yeah, definitely. Another one of those nutrients is saturated fat. So your body does need fat. There's some fats that are really, really good for your heart, and then there's some that's not so great. And that saturated fat, it's going to be found on like animal products. So if you get a piece of meat and you see that big white chunk of fat, that's a saturated fat, and that's not good for your heart. Also looking at things like butter, lard, coconut oil even is really high saturated fat. We talked about that one.
How do you feel about coconut oil?
I dislike it.
It's funny too, because I came across, there's a doctor that I occasionally follow on social media, Dr. Andrew Weil, who created he created an integrative medicine, the leader of that, and he's very intelligent, and he was just talking about coconut oil and how he dislikes it for the same reasons you were saying. So it's just funny they came up recently.
Yeah, I'm gonna go follow him. But yeah, no, it's one of those things that, like, sure, you might get some small benefit from maybe some like mineral or vitamin that's in it, but to get any actual benefit from it, you're gonna have to really eat a lot of it, and that's just gonna be too much for your body to take on. So honestly, just skip it, use the olive oil, and eat the other foods.
Yeah. And make sure you buy, I mean, this is a whole other conversation in itself, but the quality of olive oil is like, they're not necessarily, they're in a way not real. You have to, typically, if you want to get a good olive oil, it's going to be more expensive. Make sure you see where it comes from. Make sure it's cold pressed. There are certain marketing terms that you need to know, so you're not tricked into buying something that says it's olive oil, but it's not really, or it's been extracted in a way that's not necessarily beneficial to your health.
Yeah. And we talked about that before with the marketing. I mean, that's a whole nother video itself. Is just like the marketing scams that, I mean, as consumers we get, but 100% read those labels, arm yourself with knowledge, and know where your food's coming from. So I found this really interesting fact from the CDC, and it says reducing average population sodium intake to 2,300 milligrams per day. That's only 1 teaspoon, which that's the top of my thumb there. 1 teaspoon per day saves $18 billion in healthcare dollars and reduces cases of high blood pressure by 1 million annually.
Wow.
So I guess just like as a population, like we're just consuming so much salt and sodium that, you know, even if we bring it down to even a still pretty high number, we're going to save a bunch of healthcare dollars.
Yeah. And it speaks to another way of going about eating that we, especially Healthie Coach, you, the coaches, all of our coaches, what our principles are based on is just making very small changes. It's not a statistic that's saying drop salt, right? Salt is bad, right? And this is where sort of diets come to play. You always have these extremists who are saying, well, salt's the worst, or it's the best, or this is the worst, this is the best. In the end, when you want to change what you're eating, it's really just about making small changes. And that statistic is really, speaking to that. It's just a small change in your lifestyle can make such a drastic difference. It's just these small changes over a long period of time can really save your life.
Yeah. And that's one thing I like about this approach is that it's not saying like, don't ever eat salt again. It's like, well, let's just bring it down to like a more moderate level. The DASH diet really does encourage people to bring it down to 1,500 milligrams of sodium a day. But I mean, they're even saying here at 2,300, like we can still see a ton of benefit. So again, it's like, how much sodium are we all actually consuming?
Yeah, exactly. We on average probably consume a lot of sodium in America here. So it's just about bringing it down slightly. Also being, again, realizing, being realistic that most people are so used to eating a certain amounts that if we were to advise people to, eat, almost no sodium, even though it may be healthy for them, it's not realistic because we're used to eating a certain level. We have to appreciate that and understand that. So being realistic with the goals that we set and the advice that we give is what helps and leads people to have success long-term and sustainably.
Exactly. Yeah. And again, I mean, this approach, it just talks about, like it sets some goals for you, your grains, like 6 to 8 servings a day of whole grains. I'm sorry. Can you hear my dog?
That's fun.
Okay. You can edit that out, right?
Yeah. Don't worry about
it. Okay. So it talks about having 6 to 8 servings of grains a day. And I mean, that would be like a slice of bread or, like half a cup of cooked rice or pasta. So, I mean, you could have like a whole cup of pasta if you want to. I would aim for the whole grain pasta or whole grain bread just to get your fiber and a couple more nutrients in there, so it's very realistic. Your vegetables, 4 to 5 servings a day, fruit, 4 to 5 servings a day, low fat or fat free dairy products, 2 to 3 servings a day. So it kind of just lays out some goals for you to try to aim for every day. So it makes it really doable, really achievable. And it doesn't cut anything out, even sweets. It says sweets and added sugars, 5 servings or fewer per week. And they kind of give you some guidelines, 1 tablespoon of sugar or jelly, half a cup of sherbet.
But Coach Kathleen, this is not sexy. This is boring. Like, where's the muscles and where's the like antioxidant power and where's the
it's there
longevity and where is all that? This isn't exciting to me. This is boring.
It is kind of boring, but it's Honestly, such a great approach. And all of those things that you mentioned are there because it's promoting all the fruit and vegetable intake that have your antioxidants, that promote longevity, that help you battle off, diseases and chronic illnesses. So it's all there, just packaged up in this brown, boring box called the DASH diet.
And see, that's it. This is what most people should sort of be aspiring to, just a very average, moderate way of eating. And obviously people take it and you make it your own, but this is sort of, the goals that we should all kind of be looking at. We shouldn't be looking at this, going after all these all or nothing or these very extremist approaches, even though they may work for some people. Most people have to be realistic and just focus on something like this.
Exactly. And I mean, I don't know, sometimes my Facebook feed is all like, oh, I'm on this diet and I don't know where to eat, or, oh, I need ideas for this kind of diet. And I'm like, this is more of a realistic approach that it's like, you don't have to blast it on the internet that you're doing this. And you're just like, oh, like I can do this. I can make these little changes. Or, for lean meats, it's saying 6 1-ounce servings or fewer a day. So like, what if I was doing less than that? Well, how can I work my way up? Versus like you were saying, oh, we're just going to cut out all the salt. We're just going to get rid of everything. No, it's not like that. I'm only going to eat meat forever. I think about that diet and I'm like, how do we make meat taste better? We add a bunch of salt to it. So if I'm sitting here eating a bunch of meat all the time with a bunch of salt on it, again,
not good.
Not recommended. -10 out of 10.
All right. So any other tips you want to give someone when it comes to, how they can eat a healthier diet, such as a DASH diet?
Kind of just what we said, take it slow, kind of look at it, see where can you make those 1 or 2 changes. Be realistic. You can't do everything in a day. So just focus on one piece of it, even if it's just lowering your sodium, buying lower sodium products. Read the label that says no salt added, low sodium. If you're going to go out to eat, maybe you can ask, hey, can I get that prepared with less seasoning or no salt, and then put it on yourself? Because when you do it yourself, you're going to be more mindful. Always, you're going to be more mindful of how much salt and fat you add to your food, especially if you're in a mind state of making changes and working towards a healthier lifestyle.
Yeah. It takes a lot of work. There's a lot of things you have to pay attention to and do and continue to do over a long period of time. And for a lot of us, it's difficult when we live busy lives and we have a lot of other things that we have to worry about. When it comes to food, it is hard to stay accountable and continue to make these healthier choices. So obviously at Healthy Coach, we're Kathleen, you, and we have other great coaches who work as healthy coaches and help people make these changes in a sustainable way. Because like we were talking about earlier, typically these fad diets, right, they last not so long because they tell you to do one way of eating, but it's unsustainable. So what we all have to do is look at where we're at, what we're currently eating, and then start making small changes to the foods that we eat. And a Healthy Coach is here, someone who is educated and has a strong background and is super supportive and motivational and can help you make these small changes in a way that you can sustain for good over a long period of time. And it's not a one-size-fits-all thing. They're not here for a month to help you lose 20 pounds so you can look good in bikini. We're here to save your health, to essentially save your life to a point where you no longer need us. We're helping you become independent, empowered so that you can live a healthy life once and for all.
Yep. And you said the key word, sustainable. So what can we do right now, tomorrow, and in the future?
Exactly. Free the Liver King.
Long live the Liver King.
All right. That was a nice talk.
Yeah, I enjoyed it.
Thanks again, Kathleen. We'll be back to talk about another type of diet in the weeks to come, and I'm looking forward to that one. Maybe it's going to be something sexy. Maybe it's going to be something boring. We don't know.
All right, we'll find a sexy one. We'll find a healthy, sexy diet.
Is it out there? We'll
Maybe
see.
not.
All right. Thank you very much, and I'll talk to you later.
Okay, bye.